to reduce gang violence. And some of these newly formed coalitions put the gunshot victim first. The idea is to go straight to the trauma unit.
Multiple gunshot wounds, one in the head, one in the chest.
This kid had two potentially lethal, not potential, but certainly lethal injuries. He had one to his inferior vena cava, another one to his left iliac vein.
This is St. Francis Medical Center's trauma unit in Linwood. Dr. Shaka Shepard heads that unit.
Our average penetrating trauma percentage ranges anywhere from 37 to 40%, which is an astronomical number for a trauma center. Currently, we reflect a public health crisis. Not many people know that the #1 cause of death in America between the ages of 1 and 44 is trauma. And we feel like we have a responsibility to provide education, provide support.
So last year, Dr. Shepard and Injury Prevention Coordinator Paul Carrillo started Haven, Hospitals Against Violence Empowering Neighborhoods, a collaborative effort among the busiest trauma units in LA to prevent injury and stop the violence.
We talk to kids about conflict resolution, gun violence, cultural diversity, cultural awareness, anything that we can educate the young kids with that hopefully will help prevent some of the violence that we see. And when I was growing up, everybody was a gang member, my aunts, my uncles, my father, so it was like the norm. So that's why I know that it's difficult for some of these patients to come in here. It's not as easy as saying, hey, would you like to get out of the trouble you're getting into? Essentially, we're probably asking them to disown their own family.
I work as a chaplain. I see a lot of patients that come in through the ER as well.
10 years ago, Brother Cesar Galan came to St. Francis after being shot at his home on the same night his brother was killed.
You just think it's all a dream, and then you wake up and you realize you have tubes, and you know people are crying everywhere, and family. My brother was going to die. Well, he was brain dead, and that they were going to take him off the vent, and that I was paralyzed. And I said I want to see my brother one last time, so I was able to say my farewells.
He traced his fingers across his chest, and I said, no. I said, the bullet went through your spine, you'll never walk again. So then he pulled my shirt and dragged me to the bed, and he said, then teach me how to fly. A year later, he came back to St. Francis Medical Center, and we hired him as a trauma chaplain. And he just celebrated 9 years of working here with the trauma patients.
For almost 25 years, Brother Richard Herbie has been with St. Francis.
Paul's work at St. Francis is to assist those individuals who are at risk to achieve their full and free human potential, to be all that God has created them to be. And oftentimes, in the midst of trauma and chaos, there's an opportunity for redemption, for them to turn that pain and suffering into a gift for God.
When we come back, a look at the groups working to stop gun violence.
We have to work with this, make this work to avoid someone else from getting killed.
As Eye on Our Community continues with LA's gun buyback.
The moment you've been waiting for.